Hello again, everyone, and welcome to part 2 of our lecture on Chapter 13, the assessment of personality. So, in the first part of our chapter, or our first part of our lecture on Chapter 13, we really focused on the common standard assessments of personality, or those structured assessments of personality. In the second half of the lecture, we're really going to focus on the unstructured assessments of personality and what they mean in the context of counseling work that we do. I will preface by saying that a lot of the assessments that we're about to talk about for the unstructured assessments of personality are what a lot of people in sort of lay populations think about when they think about psychology, especially psychology of personality. These are the assessments that come up and the sort of tasks that they think all therapists use. So you're going to have to bear with me because I get a little bit nerdy about these topics because I think they're fun. So keep that in mind as we're going through this part of our lecture on Chapter 13. So as we mentioned in our first part of our lecture, there are two different types of personality assessments: the structured or objective personality assessments, and the unstructured or the projective assessments of personality. With structured and objective personality assessments, there are typically forced answer options. You have a very limited number of answer options and you are forced to choose one of them. Unstructured personality assessments are different in that it allows for multiple responses on all answer options, because what you're doing is you're asking someone to give their response to ambiguous stimuli, and the responses that someone gives are then used to infer information about a person's personality. Although these tests are reported to be used minimally, in counseling professions, they do possess some clinical value in the regards that someone will project their information through, or project their personality through the information that they share during the assessment process. And projective assessments can be classified in 5 different ways, or 5 techniques for sort of distinguishing these assessments from one another. The first of those is the association to ink blots or words. The second is story construction or sequences. The third is sentence or story completion. The fourth is picture arrangement or selection of verbal choices. And the last is the drawing or play techniques. So we're going to break down some examples of all of these in the next few slides throughout this lecture. But these are the 5 different ways that we break down personality assessments that are unstructured, these projective personality assessments. So probably the most famous of the projective personality assessments is the Rorschach inkblot test, which is the most widely used projective test within the helping professions. It involves a series of 10 ink blots, and responses are categorized according to the location of the response on the ink blot, the feature that is determining the response, and the content of the response. So when someone is administering the Rorschach, I'll back up just a little bit in that in order to administer the Rorschach, you have to take a class, like a semester-long class with someone who has been trained on the Rorschach inkblot test, and then that person trains you on the Rorschach inkblot test, and you have to practice it multiple times, and you have to practice scoring it. It is an incredibly tedious process. But the Rorschach is really unique in that one of the ways that you use the assessment is that you sit directly beside your client and you hand them one of these 10 cards, one at a time, and you go through them and you ask the person, what might this be? What is in this inkblot? You only ask, what might this be? And then you as an assessor say nothing. And while the person is responding, you are typing exactly what they are saying, word for word, mispronunciations, grammatical errors, every ah, and pause. You are asking and recording all of that. And every response is then scored based on the actual content of what they're saying, what part of the inkblot they're using to form their answer, as well as the location of the response on the inkblot. And Once you get all of these responses, you then go through and you ask the client, what did they mean by this thing that they said? So they go through all 10 cards and you ask them, what might this be? And then on the second round, you go through it again with them and you said this exact thing, and you say to them word for word what they said to you the first time. And then you ask them to explain what they meant when they said that. So by the end, you end up with multiple responses, because even though there are 10 ink blots, most people have multiple responses on each ink blot of what's going on. So typical sort of ideal is that you want 28 different responses. And once you have all of that typed out, you end up with these huge documents of data that you have to sort of comb through and score. And it's really difficult because the scoring systems are different depending on which sort of program you're using. The best or most popular scoring system for the Rorschach is the Exner's comprehensive system. It's the most popular scoring scheme used today, but I think it's important to recognize that it costs money not only to get access to the Rorschach testing materials. And when I say access, I mean for the 10 cards, it's close to $1,000 just to get the 10 cards. And that's not including your subscription to the Exner scoring system, nor any of the book materials that you might need to do hand scoring. And then that doesn't include the amount of cost to you as in terms of financial and in terms of time just to learn how to administer the Rorschach. So the utility of the Rorschach for personality tends to be pretty limited for quite a few reasons, but it is really good at detecting psychological dysfunction and psychosis. So even though the Rorschach is labeled historically as being an assessment of personality, it's a little bit limited in its ability to actually measure personality, but it is extremely good at detecting when someone is experiencing psychological dysfunction and when someone is experiencing active psychosis. We also have the thematic apperception test, or the TAT, and other construction techniques such as the children's apperception test and the tell me a story. All of these provide opportunities for your client or your test taker to look at cards and make up and detail the sequences of a story. So within the thematic apperception test, there are 30 black and white cards, and 20 of those are used during your assessment. So you get to pick a random 20 out of those 30 that you present to your client. And most of the cards are drawings of humans engaging in some activity or some behavior. There's always more than one person in the image. And what you do is you ask the person what's going on right before this image was taken, what's going on in this image, and what do you think could happen in the future. The children's apperception test is similar in that regard, except that the cards are oftentimes a little bit more applicable to children in that they're not always humans in the cards. Sometimes there are animals. And the idea is similar, except that you only use 10 images with the participants. But again, you're still asking the client, what went on right before this happened, what's going on in the image, and what could happen after, or what is going to happen next. And then, as I mentioned, one of the other construction or story construction techniques that is used is the Tell Me a Story, or the TMAS, which is intended to be an adaptation of the thematic apperception test that can be used with diverse populations. So specifically, the images that were used in the TAT were redrawn for the TMAS using diverse people in the images so that you can have a better match between your client's identities and the identities of the people in the images. So there are different versions of the TMAS depending on the client's identities. The two that are most known, or the two that I know of the most frequently, there's one for individuals who identify with the Latinx community and one for individuals who identify as being part of the African American community. So you really get a little bit more of that variation within the diverse populations. We also have the Rotter Incomplete Sentences Blank, which consists of 40 sentence fragments written within the first person. And a single overall adjustment score is calculated, although counselors oftentimes will adjust the responses or the sentence blanks to based on the initial session with the client so that the content that they're providing best matches the client's presenting concerns. So some examples might be, my mother is, and that's like a standard rot or incomplete sentence, or I feel this way about, or like, sleepovers are, or something like that. And as a counselor, you get a little bit more flexibility in changing some of the sentence stems so that it really is a best match to your client. And you get that idea of what's going on for them inside. We also have the Draw a Person test, or the DAP test, which was developed from the Draw a Man task and involves presenting a child or an adolescent with the task of drawing a person using paper and pencil. And given the psychometric concerns with this technique, counselors should integrate this technique into their overall assessment of the presence of emotional and behavioral problems. So, in other words, the reliability and validity of the Draw a Person test isn't great because there's so much variation in it. And that's actually true for most unstructured personality assessments, is that the reliability and validity of these tests is considerably lower than the structured assessments of personality. But the Draw a Person test can be used to help supplement sort of the clinician's impression of the client as having behavioral and emotional concerns. So when someone is administered, or when an adolescent is administered the Draw a Person test, everything that they put on the paper is considered part of the scoring. So everything from the size of the body parts that they draw to the shading and even excessive erasures are considered components of the child's function. And the DAP has been used heavily, or has been critiqued heavily, for its lack of psychometric merit. And counselors are encouraged to then just use it to help inform other things. And I guess you can see why it has lower validity and reliability, because there's so much variation that comes into how you interpret it. And we also have the house tree person, which is a projective drawing technique that relies on a child drawing a house, a tree, and a person, and then you ask the child to describe the features of each of the drawing. The client is then scored based on the components that they include in the drawings. So everything from small windows on the house could mean a lack of interest in people. Drawing dead trees could represent the presence of suicidality, depression, withdrawal, or guilt. And things like long feet on the person that they draw could indicate a need for security. The house tree person tends to be used primarily as a way of interactively engaging a client to determine therapeutic interventions, particularly with young children, because they might not always know what they need in therapy, but there can be some pretty clear concerns that they might need some different specifically focused techniques, and house tree person can help identify that. And given the importance of wellness in our society, it's important for counselors to continually evaluate an individual's wellness. And there are some different measures that you can use on health and lifestyle to better understand our clients. The first of those is the Battery for Health Improvement 2, in its shortened form, the Brief Battery for Health Improvement 2. And those are used specifically for identifying psychosocial factors that can serve as barriers to health improvements or injury recovery, which can be helpful depending on your client's presenting concern. We also have the Coping with Health Injuries and Problems inventory, which is useful for exploring what coping strategies a client is using to try and improve his or her health or wellness. Or I apologize, that was extremely binary. To explore a client's health and wellness, their own health and wellness. We also have the Wellness Evaluation of Lifestyle in its briefer form, the 4 or 5 factor WELL. And both of these are designed as measures of lifestyle tasks on wellness. And we also have the Lifestyle Assessment Questionnaire, which can be used to evaluate lifestyle in 6 different areas. I'm not going into a lot of detail on these particular inventories just because a lot of times in the work that we do as counselors, this can become a focus of the work that we do with our clients depending on what the client wants. If they're wanting to improve their health and wellness, maybe you would consider using these inventories as an intervention with your client. But other times, sometimes we just assess a client's inventory or assess a client's well-being just based on conversations that we have with them. These inventories can be particularly helpful if you're not feeling confident in the way that you're asking your client questions about their health and lifestyle and wellness. So these can be a way to give you a little bit more structure to those conversations, but they're not always necessary. It just sort of depends on you and your client. And that is where we are going to wrap up our conversation on chapter 13. As always, here are the questions to help you study for this chapter to make sure that you're covering the most important concepts when you're preparing for the final exam. And I will see you all in the next lecture.